Yamine soge wa tini ai get that chapobaka gamla ta osu o clear la growakone wakala public health, understanding the importance of public health. So our objectives in what we are focusing on in public health is what is public health? What is the meaning of public health? How does public health affect our community? What does public health do for our community and the importance of public health in today's community? And I would also talk about the key functions of public health. So what is public health? Public health, defined by Institute of Medicine, is the activities that ensure conditions in which people can be healthy. These activities include community-wide efforts to identify, prevent, and combat threats to the health of the public. So, I'm going to talk about a little bit about public health from the past, present, and the future. So our achievements from the 20th century concerning public health and what public health has done for the community is vaccinations. We have improved the rate of vaccinations, and we have more people have access to different vaccinations. We also had improved sanitations. We promote healthy hand washing techniques, making sure you wash your hands for about 15 to 30 seconds to make sure you get all the germs out. We also have fewer deaths from heart disease and stroke. So heart disease is the #1 leading cause of death here in America. So we found ways, different exercises and different preventions that we can use to help prevent less death caused from heart disease. We also we have healthier mothers and babies. So back in the days, mothers would die from pregnancy. So with public health, we focus on research and prevention efforts on what could be done to have less mother dying from childbirth. And due to that, we have healthier moms and healthier babies resulting from that. We also have a reduction in tobacco use. I know here in America, many people smoke and use tobacco, and that causes heart disease, and with heart disease you can die from that, which is the #1 leading cause in the United States. So we promote safer ways. We promote no smoking, making sure that everybody find different ways, different alternatives to not smoke. So for the 21st century, we have chronic diseases, H1N1, new and re-emergent infectious diseases, and a natural disaster, which is a huge problem as of the 21st century. And as you may not know, COVID-19, it's one of the biggest issues here in the 21st century, starting in 2019 all the way up to now. So with public health, it put public health to the forefront on what we can do better, on ways that we can prevent the next epidemic from happening, and providing safety measures that can help. So what does public health mean to everybody? So public health is a big realm with different topics, but I will describe and explain to you some of the stuff that public health focuses on, which is safety measures. We promote health, making sure you wear your helmet, safety gear, so when you fall off your bike or you fall off anywhere, you are safe. So we promote, like, make sure you wear your car seat in the car, and different other safety measures. And we also promote making sure everybody have clean access to water. So having clean access to water, having clean access to housing, access to food, healthy food, finding ways where people can get this to them. Obviously, we promote no smoking, because smoking is bad, and we also promote different harmful stuff, making sure we find different alternatives and what we can do to stop people from engaging in these harmful substances. And also, we also help with preventing of diseases, prevention. So before you enter the hospital will treat you for your illness, your sickness. But with public health, we find ways on what we can do to prevent you from going to the hospital in the first place. So the biggest thing about public health is we make the invisible more invisible. So with public health, we focus a lot on health equity. We focus on health disparities, on the minorities, and how it's harder for them to get access to the resources. So we try to find ways in the community on what we can do better, and working with different organizations and nonprofit organizations to help them get the food and resources that they need, that they won't be able to get access to due to their income, their socioeconomic level, where they live. So public health focuses on many different variety and different social determinants and factors in what is preventing people from getting the healthy and the access to care that they need that they were not able to get to due to their circumstance. So the 10 essential public health services. Here we have the 10 essential ones. So obviously we monitor the health of our community to see what's going on. You can see any problems, or we try to find abnormal findings in our community. And when we do find it, we bring that subject up to talk about it and what we can do to solve that problem. We investigate and diagnose health problems and hazards. We inform and educate the people. So with public health, we have health promotion. So that is where we talk about public health and health issues. We mobilize partnerships to solve community problems. So we'll work with nonprofit organizations such as like RCS, food banks, homeless shelters, to talk and identify these problems and what could be done. We also support policies and plans to help achieve health goals. With public health, we also try to come up with different health policies that will make it easier for people. We also enforce laws and regulations to protect health and safety. So with COVID-19, we work with health officials. We mandated mask mandates to make sure everybody is safe during COVID and it doesn't spread, and making sure we had vaccines rolled out to everybody in the community. We also linked people to needed personal health services. So we work with homeless shelter, of course, food banks to make sure that healthy food and food is accessed by people who don't have the money and the means to afford healthy food. So we work with them to make sure that food is accessed to them. We ensure a skilled, competent public health workforce. All our public health officials are very competent, and we evaluate effectiveness and quality of health services, and we research and apply innovative solutions. So with public health, we do a lot of research. We gather a lot of data to make sure that we have all the information that is needed, and we use that information and data to make public health better. So public health is all around you, everywhere you look. Public health has worked on that. So with public health, we help with the promotion, preventative measures to make sure that people don't get sick, and finding safer ways for people to make sure they live in a community where they're healthy. Everybody who gets sick goes to the hospital nurses, doctors treat them due to their sickness and illness. But with public health, we work really hard to make sure that doesn't happen, so you don't end up in the hospital. We help ways to prevent, to make sure that you're healthy, safe, and nothing happens to you. With public health, it was put on the forefront in COVID-19. Public health officials, we worked really hard during COVID-19 to make sure everything was rolled out, the vaccines were rolled out effectively, masks were mandated, working with different officials to make sure to stop the spread of COVID-19. So that is all to my presentation today, and I hope you learned a lot from what was explained to you during this presentation. Omusopa Gongade Daplin.